Perfect. Recording started. Okay. Thanks everybody for joining us today. As promised, we're going to start at 2:30. I know that your time is very valuable and we don't want to take up extra time waiting. I wanted to give a reminder for anyone that missed my initial shout out that today we're going to be using what we call breakout sessions. And so you're not going to be able to attend the breakout session, which is the second portion of this call, if you're just a call-in user. So if you're dialed in on your cell phone and you're just listening, you don't have access to see the slides. Call-in users cannot attend the breakout sessions. If you're using a phone, we ask that you switch to the WebEx mobile app, and that will allow you to go into the second portion of the call with us. Or if you're using a computer, that's fine as well. And then
You're not in Jersey?
Yes.
She's coming
Sam
tomorrow?
has been consistent.
What does Sam
She's
tell
not
her?
coming tomorrow.
Oh, no.
can I ask everybody who's on the call to mute your lines, check to make sure that your microphone has a red line through it. We have you all listed as panelists right now to allow you to ask questions at a later date or at a later time, but we ask that you mute your line so we don't hear your conversations or anything going on in the clinic while we're presenting. You will have the opportunity to ask questions at the conclusion of this section. Or if you have something that pops up, you don't want to forget it, you want to ask right away, you can throw it in the chat and we will address it at the end of this first portion. In addition, if it's something hospitalization specific or transplant project specific, you can wait till we go into the breakout session to ask because the rest of the group might want to hear the question as well. We do ask that you be present and engaged. All the information we're sharing is vital to success throughout this project, and then all meeting material will be posted to IPRO Learn under your Community Coalition section within about 5 business days after this call. So we wanted to first start by sharing what the IPRO ESRD network service areas consist of. So we do have 4 networks. If you're unaware, the large oval of IPRO ESRD network program numbers is an aggregate number of who we work with on any given day, any given basis. So we oversee about 125,000 dialysis patients. We oversee 1,956 dialysis facilities. So I work with that many on transplant. Katie works with that many on the hospitalization project. So it's a large undertaking. And then 53 transplant centers. So for the 2023-2024 statement of work, which is essentially what CMS gives us and tells us what to focus on in order to improve access to care and quality of care to our ESRD patients, there are program objectives that we have to focus on. There are some updates to these initiatives for this year, which actually just started about 9 days ago when May 1st rolled around. We have all the program objectives listed on the screen here. The first, we focus on behavioral health outcomes, patient safety, and reducing harm in vulnerable populations, improving care in high cost and complex chronic conditions. That one's bolded because that's what the transplant project falls under. We have a reducing hospitalization and outpatient emergency room visit section, and that's what the hospitalization project falls under. We do work in nursing home care, focusing on low performing providers, and then also we work on providing targeted quality improvement responses. Included in our work, there is a cross-cutting focus for increasing health equity and access to resources, focusing on rural health for patients that live in a rural setting, and then also patient and family engagement to increase outcomes. The 3 areas are bolded on the screen. Those 3 areas we really focus on for this community coalition project, and that's why they're bolded. So what's our approach? So the first thing that that we asked you to do when we first sent you that inclusion letter a few weeks back was read this letter, do a root cause analysis, sign up for this call, and we're here today to talk about why we're doing all of that, right? And what's to be expected over the next couple of months. So you as a facility, by identifying what your root cause analysis is, or what your root cause is, completing the root cause analysis and committing to completing this project, which is the Plan, Do, Study, Act cycle. You work on driving improvement in multiple areas of quality improvement at your facility. You allow the network to understand local and regional issues that affect our network outcomes. And you also work on fostering a focus on an increase in health equity and access to care for your patients. So just by engaging in this process, putting forth the effort, really working on barriers that you see at your facility, you're actually helping the community as a whole in more ways than you really realize, right? So what does the work of this community coalition project consist of? So the first step, which I've already mentioned, I think twice, is the root cause analysis. So this root cause analysis is the first step in problem solving. What we ask you to do is identify your high level problem at your facility. And we're doing that in different different topic areas. So if you're a part of the transplant project, we're asking you to identify your high level problem at your specific facility related to getting patients on the wait list or transplanted. If you're a part of the hospitalization project, we ask you to identify your high level problem to patient hospitalizations, ED visits, and patient readmissions. So, what we have you do is go through a process called the root cause analysis. We ask you the 5 whys, and this video, I actually have a screenshot of it here. And this is in your root cause analysis activity in IPRO Learn for your viewing. But what it does is it asks you the 5 whys. And you take a high level problem, it asks you the question why 5 times until you narrow it down to what the root cause is to that problem. Sometimes it can take less than 5 whys or more than 5 whys, but they call it the 5 whys because that is the average amount of questioning that it takes to come across your root cause. So, your root cause will be the barrier that you should be working toward overcoming or solving throughout this cycle. I want to stop real quick and let you all know that if that process is very confusing, that is why Katie and I are here, and it's our job to help you figure out how to do a root cause analysis and pick the best topic and the best focus for your facility. It is a quality improvement process. It might not come naturally to you, but that's why we're here to help you all establish this foundation for the rest of this project lifecycle. The rest of your project, the rest of the 6 months, really depends on if your root cause analysis is done and done effectively. After you do a root cause analysis, we will put you through what is called a Plan, Do, Study, Act cycle. And what this is a 4-stage problem solving model for improving a process or carrying out a change. So it uses internal, which is the dialysis facility, and external, which can be transplant centers, patients, hospitals. It uses both of those entities to determine what change is needed, and it generates feedback on what is working and not working. So, making a change, it may not work, it might work well. This process allows you to analyze that. So, why are we conducting this? All facilities here that have been chosen to be a part of the community coalition have room for improvement. We select you based on data, we select you based on geographical location, patient census, and there's always room for improvement in your practices and processes to improve the care of your patients. We work together on improving the processes to ultimately provide better care for all of the patients. So, how are we going to allow you guys to stay on track? We implemented this process a while back where we provided you all a quality improvement outline for this community coalition project. This outline is housed in iPro Learn, and at any given time, Katie or myself can also email you a copy of the outline if you don't have it handy. What the outline does is it tells you every single month what the focus should be and what you should be striving toward to keep you all on track throughout this project. I did take a screenshot of month 1, and this is similar to what you all received in your inclusion letter, and it has a couple of key points to complete in this first month of the project. If you're on the call today, it means that you received the letter, you looked at the outline, you realized you needed to register for this call, and here you are. So it already shows that it helps a little bit. But I do want to point out that we have a column for staff-focused activities. This is what you all as dialysis providers and as the care team should be working on throughout the project. And then we have a column for patient-focused activities. So um, a lot of the work that is done throughout the Community Coalition project should include your patient facility representative. And if you don't have one currently, you should be working toward finding one this month or communicating to us your difficulties finding one, and then we'll help work on a solution with you. I also wanted to point out that we help you stay on track by providing monthly emails and red cap surveys. And then we also communicate with your PFRs on a monthly basis through a platform called Text 'em All. And so while you guys are receiving communication and information from us, we're also communicating with your PFR to help close the loop on communication about the quality improvement project. So I wanted to add this slide in. This is a large change that has occurred since May 1st in our contract, and it it's all based around on-site visits. And I know that can be scary, but hear me out. Some community coalition facilities will have an on-site visit by a member of our IPRO ESRD network staff. Many of these facilities are already identified. We have identified, or CMS has identified you as living in a specific area who falls under maybe a more disparate population or what um, the different databases that exist through the CDC of a place that might be at a higher risk for disparities. So there are facilities that are in amongst us right now that we are already eyeing for an on-site visit. You will find out at a later date when we contact you if you are one of those facilities. Not everybody will have an on-site visit, but what the on-site visits include are we will come, a member of our team will review your data outcomes and areas of improvement. And it won't just be for transplant and it won't just be for hospitalizations. It could be across any different quality improvement area that you might be struggling in. We do provide network quality improvement assistance. We can give you resources and help with intervention planning to mitigate future barriers in a face-to-face setting, and then help ongoing support through your Plan, Do, Study, Act cycle. So if you're struggling right now with thinking of an RCA, thinking of going through that PDSA cycle that we just talked about, this can be face-to-face one-on-one support at your center. The site visits are solely focused on providing help to you all as facility members, addressing barriers related to quality improvement, and increasing a health equity focus, especially for your patients. These are not audits. We know that survey and certification can come and they do audits. We're not as scary as that. We're here to help your quality improvement outcomes. All right, so we just went over how we're going to keep you all on track, and I'm going to give you some best practices on how to keep your facility on track throughout this project. So these are some best practices for internal sharing and project monitoring. So we encourage you and highly urge you to take a team-based approach. No one person at the facility should be completing the start to finish. That increases burden and it reduces the chances of success or even making a difference with this project. We need the whole care team, including the patient facility representative, involved in what this project is and putting forth effort to make improvement. So the first bullet is inclusion of your patient facility representative and care team. So you're on the call today. What we cover today should be talked about with the care team and that PFR. Whatever topic you decide to work on for your quality improvement project, it should be a topic at your QAPI meetings on a monthly basis. You can take the topics that you're working on in this project and use them toward huddle board and bulletin board topics. And then we also encourage a team-based approach with the delegation and sharing of the red cap surveys that we send you every month, as well as any IPRO Learn responsibilities. Once again, one person doing it all, it's only going to increase burden and decrease success or any positive outcomes in this project. And then following your progress, another best practice is using the reports that the network sends you every month based on these QIA goals that CMS sets. So here I have the transplant and waitlisting report and the hospitalization report. Maybe it can jog your memory if you've seen it come into your inbox. So these two reports give facility specific outcome data on how you're doing in these metrics. These reports come directly from the source, so if you have a question or concern about the data on the report, we can help you via our help desk, but typically it's either an internal tracker of yours that might have an error, or if it's transplant and waitlisting, maybe it's the transplant center hasn't inputted the information yet. But these reports are as close to the source of truth as possible. And so you can use these reports to track if your metrics are increasing or decreasing as they need to. I do want to add, we also in these reports add in if your patient gets admitted to the hospital, visits an ED, gets waitlisted, gets transplanted, we add in the patient UPIs so you all can more easily locate and figure out which patients are causing your metrics to go up and down. And the last slide that I'm going to cover is facility expectations during the Community Coalition project. So the first expectation is that you complete the root cause analysis in the PDSA check-in emails that we send you. If you have a problem with work overload or there's a facility conflict and something can't get done and whatever the issue may be, the best thing you can do is be open and communicate that with us, and we can help you formulate a game plan. We'd like you to collaborate with the network. So that's Katie and I. Collaborate with us and schedule one-on-one meetings if necessary. Uh, Katie's going to go through the different platforms where you can contact us. But I know that on every email that we send, there's contact information. There's a way to get a hold of us via phone and email and face-to-face like webinar conferencing. So get a hold of us if you guys are having any problems throughout your project. The expectation is that you review your monthly IPRO Learn interventions, you share your progress with us, and share any best practices that you've come across. When we do have our best practice webinar series in a few months, we expect you all to be in attendance or even volunteer if you'd like to be a speaker. Really dedicate the 6-month cycle here to improving your facility's performance. You're only with us for a short time, so you might as well make the best of it and see if putting forth really great effort causes an increased outcomes for our patients. And the last expectation is that you integrate your patients into the work. This means getting a PFR involved and having them come to QAPI, any other way that you can get the patients involved and increasing quality improvement. All right, so I'm going to pass the ball over to Katie, and she's going to talk about the different platforms that you may be using throughout this cycle.
Good afternoon, everybody. So I'm going to go over some of the platforms that we're going to be using throughout your time when you're in IPRO. So IPRO Learn is our first platform. It is a 24/7 learning management system. You will find announcements in there. You will find CE offerings, shout outs to certain facilities. There's also going to be a section where you are to do. Those are required monthly activities when you go in. And there's also a CE offering, and there's also discussion boards. Oftentimes we will ask you to look onto the discussion boards. We might post a question, or it's actually really good to even go in and you might find a best practice in those discussion boards. This is the IPRO Learn landing page. This is what you're going to see when you go into IPRO Learn. You'll have your welcome, and then where the pictures are is actually where you're going to click, and that will get you into your quality improvement portion of the IPRO Learn. And then you have your dashboard over to the side that will kind of break you into each of those sections as well. Once you get into the IPRO Learn quality improvement portion, you will see what's new in recent announcements. Those will have all the updated information of good to know things that are going on and happening. And then below that, you're going to actually have the to do, that is required activities. So those actually are the required activities that need to be done monthly for the facility. And then over on the right-hand side, you're going to see the QI best practices. And that's where you can go into your discussion forum and post a question or read through some of the answers for best practices. And then in the IPRO Learn platform, you're also going to see, since you guys are in the Community Coalition, you are actually going to see a Community Coalition section, and it's going to show you the work that needs to be done monthly. And as you can see in the gray, under QIA hospitalization, it says complete the activity. Once each of those activities are completed, it's actually going to show into the green where it says complete the activity is done. So you definitely want to go in there and take a look and see if your RCA has been completed. This will also show your plan and how each month is going to progress as well. You can find in there. And then, so tips for success. Always encourage everyone to be watching the onboarding tutorial video. Only use your facility's username and password. That was actually sent with you guys on your inclusion letters that we sent out to you guys. Those are individual for each facility, and we ask that you guys do not change those. This is so that multiple team members can work together in completing these assignments, so it's not just strictly for one person. Assignments are available from the first of the calendar month to the last day of the calendar month. This gives you plenty of time throughout the month for everyone to kind of go in and tackle it as a team. And lastly, we have, I think this is last, is our fresh desk. So this is our customer support services. When you can go in here, if you have any problems getting to switch a password or you don't know your password, we ask that you put in a fresh desk ticket. Caroline, do you want to go over what the ESRD network program website looks like? This one and how to navigate that one specifically, and then I'll finish up with the Caspio.
Yeah, so we wanted to just showcase that we also have a website. So if you're unsure of how to get to IPRO Learn, you're like, where's my community coalition outline? How do I put a ticket in? Our central hub, where all of our external websites and resources are kind of connected to, is our website. And whenever we share these slides, all of the links at the bottom that say click here to access our website, those will all be live. And so you guys can click around, bookmark these if you don't already have them bookmarked. But the website houses externally, it's a public facing website, all of our publications, who any of our partnerships and collaborations are. We have our resources to all of our quality improvement projects. So if you're looking for a specific resource for a specific project, whether it's hospitalizations or transplant or any of the other projects that we focus on, our website is like the main source where all of those resources are housed. And then you can also access, as I said, our YouTube channel. You can access our help desk, our iPro Learn. Everything can be accessed from the website if you're not sure how to navigate somewhere. And let me just pass that back on over to you.
And we also have our Caspio. So when you go into Caspio, this is strictly maintained by you. This needs to be updated anytime you have any new staffing coming in, because this really helps the network decide who these emails are going to and how they're getting distributed, and making sure that we are properly getting those emails to who needs to go to. So I suggest everybody to take a look at this sometime this week and make sure that your database is correct for the people you want us to contact. And does anybody have any questions?
Hi, hello. My name is Carol Daniels. I'm the FA here at Douglasville facility. I don't know what you want, my number or my clinic number, but I wanted to ask a question. So when I go into my iPro, I wanted to know, did we have to do two transplant and hospitalization? Or how do we tell which assignment we have?
Hi, Ms. Daniels. So a week or two ago, maybe 3 weeks ago, we sent out an inclusion letter to your facility, which states which project your facility is a part of. No facility is a part of two projects at one time. So you will either be a part of transplant or home. Now, if you receive two letters, one of each, that means that you might be affiliated with two facilities that have been selected to be a part of a project. But I will let you know that if you go into iPro Learn and you look under if you look under the quality improvement section in the coalition area, there will only be one root cause analysis for that facility. It will
Oh,
either
it's
be transplant
hospitalization.
or hospital. Perfect. So your project is the hospitalization project.
Okay, thank you.
Thanks. And then there are a couple of comments. I've been on iPro Learn, but it only shows my courses under the dashboard. So Tracy, whichever breakout session you go into, we can help you more focused to kind of figure out like what you're seeing and how to help you navigate that. Brenda looks like had some trouble getting into WebEx. That's not something that we as the network can help. It sometimes depends on what computer you're accessing from or your internet connection, but maybe we can help work on a solution if you have problems later on throughout this coalition. Sometimes technology is just not our friend, and I apologize for your struggle. And then Tracy asked, where do I find the root cause analysis to complete? Is it under your iPro website? Root cause analysis is in iPro Learn. So iPro Learn is that learning management site. It's different from the website. When we go into the breakout session, we can show you again where iPro Learn is, if that helps. If no one else has any other questions, and then Miriam asked about integrating patients into QAPI and HIPAA concerns. And that is definitely something Katie and I can talk about in our breakout sessions, because that is a topic and a question that we get asked a lot. So we'll be happy to help you. I think that we might be ready to go into our breakout sessions, and I'm sure that there will be more questions regarding our specific projects. So I just want to check with Stephanie that we're ready to go.
I have a question I want to ask though.
We are indeed ready to go. I will go ahead and warn that there's a handful of you that are call-in users and a name that I can't quite recognize that will remain back. All I'll do is just ask you to let me know what room you want to be in, and I will be able to sort you in, and you'll be good to go.
Okay,
So
hold
if
on one
those
second.
presenting in the breakout rooms could hold back for just a moment, that would be great.
Okay, give me 1 second, Stephanie. Osmond, did you have a question?
Yes, ma'am, I do. I work in two facilities, Southern West and Sound Shore. So I'm split. Mondays, Wednesdays, and Fridays, I'm in Southern West. I'm calling from New York.
Okay.
And Tuesdays, Thursdays, I am in New Rochelle, Sound Shore. Here in Sound Shore, you have a full-time social worker who is not a participant of this project. Over there in Southern West, you have a part-time social worker who is not a participant of this particular project. I'm the only one, and I'm tied between two facilities. So I can see the problems, the issues already, you know. And
Yes.
as you said, if I'm the only one, I'm not going to be able to do this.
Correct. So I'm going to help you out real quick. The inclusion letters were sent to all of the staff members that we have on file for the facilities. So the social workers that might be present at your facilities, they either received it or the facility's contact database, that Caspio website, was not up to date, which we need to get that up to date. And then we can rope those social workers in to help with the project. So it's not just you working on the work. Does that sound like a good solution?
Yes, it does because I alone, I'm not going to be able. I was even thinking of dropping out. And
Oh,
it's a fun project. I want to do it, but I cannot,
right,
given the fact that I work in two clinics.
right. Let's go into our breakout sessions and we can talk more one-on-one either at the during or at the end of it, and we'll help you come to a solution.
All right, Caroline, thank you.
Perfect. All right, Stephanie, go ahead and shoot us into the rooms.
Hi, for those that are left in the lobby, would you please like to unmute yourselves and let me know where you'd like to be? You may have to accept your breakout room in order to go. So for those that are still hanging out in the lobby, you may need to approve the transition into your breakout room. There are some call-in users that are still in the lobby, so if you would, unmute yourselves and let me know what room you would like to be in.